A growing belly, leg cramps, hip and back pain can make it really hard to get into a comfortable position in bed while you're pregnant. In this video, I'm going to show you the best sleeping positions to alleviate the discomfort that comes with pregnancy and to ensure you have a restful, safe night's sleep. From 28 weeks onwards, there are some risks associated with one particular sleeping position, so at that stage you do need to consider that as well as finding something comfortable, but we'll talk more about that soon. Let's start with the first trimester. At this stage, there's no big belly and no position is going to put your little one at risk. That means you can sleep in whatever position feels most comfortable, be it on your stomach, your back, or your side. It's all about what gives you the best night's rest. Things will likely start to change as you enter your second trimester. As your belly starts to grow, you may start to experience more discomfort. This includes things like round ligament pain, which are sharp spasms in the lower abdomen caused by the stretching of the ligaments supporting your uterus. Also, pelvic girdle, lower back pain may be more prevalent as your joints loosen in preparation for birth. Sleeping on your side can really help with this, particularly when you also use some strategically placed pillows for extra support. The way to do this is to start by placing a small pillow or folded towel under your bump to support the belly. This eases the load on your ligaments and reduces the amount of twisting through your back. Then by placing another pillow between your legs, it just helps keep the pelvis and the lower back in a more neutral alignment, helping to provide relief from pelvic and back discomfort. Now, some women will experience hip pain in that second to third trimester as a result of sleeping on their side. If that is you, there are a couple of options you can try to see which works best for you. If you find you're experiencing pain in the bottom hip, you can place the pillow more at the front and bend the top leg. This helps take the weight off the bottom part of the hip and reduce pressure that can help relieve pain. If you experience pain in the top hip, then use 1 to 2 pillows to support the top leg, raising the knee so the leg is more parallel to the floor. This will stop the muscles on the side of your leg pulling and putting pressure on your top hip. Sleeping on your side is also recommended after 28 weeks. This is because lying flat on your back for extended periods has been shown to be a potential risk factor for stillbirths in late pregnancy. As your baby grows, when lying on your back, its weight can press on major arteries, affecting blood flow to your baby. To avoid this, side sleeping is advised. Either side is absolutely fine, but the left side is preferable for circulation, especially if you're experiencing leg cramps or swelling. If you wake up on your back, please don't stress. This is absolutely fine. Just roll over onto your side and find a comfy position. Or you can even place a pillow behind you so if you do roll backwards, you won't be flat on your back. Not only does lower back pain and hip pain disrupt sleep, but a lot of women in their third trimester also suffer from heartburn. This is due to pregnancy hormones softening the valve at the entrance of the stomach, allowing stomach acids to come back into the esophagus. Then, as the third trimester progresses, the baby starts to press up into the stomach, making heartburn worse. The one way to help relieve these symptoms is to slightly elevate your body while sleeping. This is one exception to the no sleeping on your back rule. By elevating your trunk to an angle greater than 30 degrees, most of the weight of the baby is still going to be going through the pelvis and not compressing on those major arteries. An easy way to do this is to prop 2 to 3 pillows behind your back to elevate your trunk. Then place a pillow under your knees to take the pressure off your lower back. If the 3-pillow trick isn't enough, that's when I'd consider adding some pregnancy pillows for extra support. There are 2 pregnancy pillows on the market that I recommend. The first is the Sleepy Belly pregnancy pillow. This one provides bump, back and side support with an optionate separate leg support pillow. The back support pillow is designed to help you stop rolling accidentally on your back throughout the night, and you can also adjust the belly support pillow as your belly grows to keep it comfy. The second one is the Body Support Pillow by Grow Bright. This is a full body length pillow that supports your bump and also has leg support, which reduces back and hip pain. The downside of this one is it is more bulky, which means it takes up more space, meaning your partner might not be a fan, but you do get your value for money as it can be used as a feeding pillow postpartum, as well as supporting your baby as they learn to sit. I've linked to both in the description down below if you want to check them out. Finding a comfortable sleeping position is a really good way to help relieve pelvic girdle pain and lower back pain. But just by modifying the way you sleep might not be enough to relieve them completely. It's much more effective if you're able to combine suitable exercises with a comfortable sleeping position. In this video, I'll show you a set of exercises to help strengthen your core, pelvis, and back. Keeping these muscles strong during pregnancy is crucial for managing pelvic girdle pain and lower back pain. So make sure you head on over and watch that one next, particularly if you're already experiencing either of those.